African-American assembly member, the only vegan, one of the only progressives in office, California Assembly. He is also the man behind AB 1400, which is universal health care or single payer healthcare in California. So
not only does it make no sense, think about especially all you young people that are getting into the workforce, and let's say you get a job and like, wow, this job has good benefits, I have really good healthcare. But then you know what? A year or two into it, you're like, I really don't want to be at this job, but I can't leave because I can't afford not to have this healthcare. How is that freedom of choice? If you're in an abusive relationship and you have healthcare because of your partner, that's part of the equation, especially if you have some kind of illness or medical condition that's really expensive. Now, why are we giving people, putting that into an equation for what kind of work you do, who your partner is? I mean, that's the reality of our life. And the last thing I'll mention is, because people talk about how much it's going to cost us, the other. Right now, employers pay $20,000 a year for their employees to have family health care. And that's just in premiums alone, $20,000 a year. Individuals pay $6,000. That's if you have an employer. If you don't, and let's say you have Obamacare, you have the covered California, is what we call it here. 30% of the people in covered California have what's called the bronze package, which is the lowest level package, because they can't afford anything higher. Well, what does the bronze package mean? It means that their deductibles are $8,200, $16,000 for family coverage. So you tell me that's access to healthcare? When you have $16,000, you have to go out of pocket for and you're probably already not wealthy, because that's why you got the bronze package. And now you have to pay $16,000 of your own money before insurance kicks in. It's complete. We're being taken advantage of. We're being used, and it's as clear as day. And the fact that, that this is a struggle of a generation is crazy. And I call it a fight for the fight of a generation, because I don't want your generation have to be fighting this 20 years from
now. Yeah. So what are your biggest hurdles?
There's a lot of big hurdles. Every hurdle is a big one. Yeah. I'm grateful that we were able to get it through the Assembly Health Committee. That was in itself a big hurdle. It wouldn't have happened if it wasn't for the support of the Speaker. I've been working with them all year long on this, meeting with his office. Senator Jim Wood, if anyone saw the Health Committee meeting, he's actually a dentist. And he was so amazing, calling out the industry, saying, we used to be about patients and we've lost our way. It was so powerful to hear that from someone that, has made a career in the healthcare industry, and the next step is the Appropriations Committee, which is meeting this Thursday. So we're going to know very soon if it's going to make it through appropriations. If it does, it goes to the floor of the Assembly, and then we have to try to get 41 votes out of 80 Assembly members. We're short 4 because people have left for different positions. Mm-hmm. So we only have 76 Assembly members. We're short 4 Democrats, because the ones that left are all Democrats.
Yeah.
And at least 3 of them, I'm pretty confident, would have voted for AB 1400. So it's that much harder to get to 41. So we have a couple really big hurdles ahead of us in the next few days. My 50th birthday is on Friday.
Gosh, I thought you were like 40. I'm not even.
Thank you.
I thought you were 40.
It's that vegan diet,
No, seriously though, it's doing you justice, man.
But I'm hoping for a good birthday gift this week, so we'll see.
So the vote, once the Assembly votes on it, then it goes to Governor Newsom.
No.
Oh, okay.
It goes to the Senate. And so we still have, we still have that all those roadblocks there. But the good thing is, this is why it's critical to try to get through the Assembly this month, because it's a 2-year bill. I introduced it last year. I held the bill in April because we were still working on the financing aspect of it. And what that means for procedural purposes, a 2-year bill has to get off the Assembly floor before the end of this month. If it gets through, then we have a few more months to try to work its way through the Senate. And then hopefully then the governor will engage on it at that time.
Okay. Okay. So like, what is your, so let's say like, what's the preferred timeline of this going through? If let's say like you don't hit any roadblocks and it like, you know, and it passes all the ranks, like when would Californians have healthcare essentially?
Yeah. Yeah. And someone mentioned it does come back to the assembly for what's called a concurrence vote. So basically any significant amendments that occur, if there are significant amendments, it has to come back to the assembly for concurrence. A bill of this nature is likely to have some significant amendments. In fact, I'm working on some amendments right now with the speaker and with the chair of appropriations, to hopefully help facilitate its passage in the appropriations committee. But ideal world, we get this through the Senate and the Assembly, through the Senate, back to the Assembly, get it passed, and go to the governor's desk, and the governor signs it this year. That's, again, ideal world. I introduced ACA 11, which is a constitutional amendment, which deals with the constitutional issues. You guys may have heard of the GAN limit, Prop 98. There's certain restrictions in law when it comes to funding and taxes. We've got to make exemptions for CalCare to allow for us to create the CalCare program. And then also in ACA 11, it has suggested taxation of how we actually tax in order to fund the CalCare program. So if 1400 gets through, then we can apply for what's called a federal Medicare waiver with the federal government. I met with the federal government, with the Department of Health and Human Services in October, and they kind of laid out the whole process. So we have to pass the bill first, and then we have to apply for Medicare waiver. And as that goes forward, if we can get ACA 11 passed in the legislature, it goes to the ballot, hopefully November 2024, which is a very friendly ballot, a presidential ballot, and that will fund the program. But once AB 1400 passes, it can start moving in terms of the waiver process. We pass ACA 11, we go to the voters, and that's when all of us have to show up and fight hundreds of millions of dollars, basically have to do a huge ground campaign, have thousands of volunteers, and fight the industry that's already starting to lie about the bill in terms of doubling your taxes, and it's going to take your health care away and all that. So, we have a lot ahead of us.
So someone just asked, can you ask him when the vote is, or do you know when it is?
The vote for the appropriations committee?
Yeah, I'm assuming it's the appropriations. She didn't specify which one, but
it's this Thursday. So find out who your assembly member is, see if they're on the appropriations committee, send them an email or call their office. It always helps to hear from constituents. So this Thursday is the vote before is the Assembly Appropriations Committee hearing. If it gets through appropriations, then we'd basically have 10 days to get it through the assembly. I'm laughing because it's a heavy lift, but it's not impossible. Folks didn't think we'd be able to get it where it is now too,
Yeah, no, that's absolutely true. I know a lot of people that were like, yeah, good luck. You know what I mean? Just like regular people like me. And I was like, I don't know, like, we'll see,
Well, I mean, at the end of the day, the industry wants us to have that attitude. Like, yeah, I like it, but whatever, it's never going to happen. That's what they want us. That's the place they want us to be in, right? They want us to be in that space, that cynical space. And we have every reason to be. We have every reason to be cynical and doubtful. But the only way this is going to happen is if we reject that and fight for someone we don't know, right?
Yeah. No, seriously. So I have a lot of questions lined up actually, but they're not like, they're not like crazy or anything like that. But I mean, for starters, like, there's a lot of like tax questions that came in from my followers, right? And which is, I guess, like pretty, I mean, we could see that right from a mile away, because I feel like everyone, well, what about me? But but what about my taxes or whatever? But before we get into that, how do you think lobbyists and big biopharma is going to react to this?
Oh, they're going to spend. I mean, it's insurance companies, the pharmaceutical industry, the hospitals, the Hospital Association, California Medical Association is opposed. And so they're all going to come after it. I mean, look, we had a pharmaceutical like pricing proposition that lost. It was before the voters a couple years back, and the pharmaceutical industry spent well over $100 million to defeat it, and they lied. They kept lying about it, saying veterans are going to lose their, their access to pharmacy. I mean, they'd have veterans up there. It's just they're gonna use fear because that's what works for those that want to push back against social change, right? It's always fear, and so we can expect the most expensive campaign ever. Last year, or what year was it? Last year before, Uber and Lyft spent, and DoorDash and Instacart, all them spent over $200 million to basically change constitutional labor laws, change the California Constitution, and change labor law for their benefit, for their profit, so they can continue to exploit workers. Well, they spent $200 million for that, and these are companies that are not profitable. It did work. However, thankfully, the Supreme Court, the California courts, it hasn't gone to the Supreme. The California courts have blocked it for now, but it's being appealed and what have you. So that's good news. But they did that for companies that are not even profitable. Think about how much the health industry is going to spend when they make tens of billions of dollars a year in profit just in California alone, right? So, we talk about the Bernie Sanders campaign and how he won California. It has to be that times 5. And I went to a lot of the Bernie headquarters, the openings of the office. I was at the Fresno opening, the Oakland one, San Jose, of course. I was down at the Inland Empire, and it was amazing to see that energy for Bernie. But it's going to take that on a whole nother level for many months. We have to be at the door. The only way we beat that money that's going to be flooding social media and ads and newspapers. Newspapers are already coming out against it because who buys ads for the media? TVs. When I go on TV interviews for local news, the big focus is, you're raising taxes. And then when they go to commercial break, what do you see? You see pharmaceutical ads. You see healthcare company, insurance company ads, right? So it all kind of connects, right?
Mm-hmm. Mm-hmm. So you're going to need a lot of ground level work, just
at some point. Right now, it's about getting this to the legislature, but
for sure.
This is a movement. I talked to a reporter from the Chronicle, and he was trying to get me to kind of throw some blows back at Gavin Newsom. And I'm like, look, at the end of the day, that doesn't benefit this movement. If we get single payer, it's not going to be because of any individual, whether it's an assembly member or a governor. It's going to be a movement, and the movement's going to have to demand it. And so that movement, and this is all, look, I have really good healthcare, and that's the funny part, right? The ironic part, the state legislature, we have really good healthcare, right? This is not something that I'm doing for my benefit. I'm doing this because we have a system that's unjust and immoral, that's fiscally unsound, and that's really bad public policy and really bad health policy. And I want to do this again so that another generation of lawmakers, of assembly members, when you're in the assembly 10, 15 years from now, you're not introducing a bill to bring single payer to California.
Yeah. I don't know.
And there's a question right here. If the bill passes appropriations, it will be eligible to go to the floor of the assembly almost immediately, which means basically next week. But it has to be through the assembly by January 31st. So that means we only have 3 sessions, the 24th, the 27th, and the 31st. So one of those 3 days, it will have to be taken up for a vote and passed. So we'll see.
Do you have enough endorsements on it from assembly members?
No, I mean, we have a lot. We have about 20 co-authors between the Assembly and Senate. But, we passed the Health Committee on 11-3 vote, which was really good sign, although at least one of them said they're not going to vote, even though they voted for it in the health committee, said they're not going to vote for it on the floor, unfortunately. But, we'll right now it's one step at a time, and I'm just trying to get it through the appropriations committee first.
Yeah. Yeah. Well, I kind of want to, ask the more like overall, questions that I received. So one of them is, how does it affect the tax of the normal worker?
Mm-hmm.
Yep.
Great question.
Yeah, this person said, I think I seen that it was going to be like going to be income based, but how does that affect people who make millions if they already have tax breaks?
So there's it's what's called a marginal tax. What that means is there's three different ways. And first of all, let me start by saying, again, this is going to be less expensive than our current system. So the overall cost will be lower. Will it be lower for everyone? Well, if someone's making $2 million a year, maybe it won't be. But for most Californian businesses and individuals, it'll be a cost saver. And let me explain how. First of all, businesses. The average business spends about 9.9% of payroll for healthcare for their workers. That's a lot. 9.9% of payroll is healthcare. The average worker spends about 2.7%. And the 9.9 is a general number. The 2.7% is for a worker making between $50,000 and $100,000. They spend 2.7% of their payroll for their healthcare. The way healthcare is done right now is actually very regressive because everybody pays the same amount. If you're working for a company and you're making $75,000 a year, you're paying the same as someone making $175,000 a year for your premiums. So that's very regressive. It's treating everybody the same, even though obviously someone making more, it percentage-wise is a lot less of their paycheck. Mm-hmm. Under what I propose, there's three things. One is a payroll tax. The payroll tax is 1.25% for employers. So think about 1.25% payroll tax versus right now they're paying 9.9% of payroll for healthcare for their employees. That's a dramatic cost savings for businesses. For a worker, if you make over $50,000 a year, it's 1% payroll. And so for someone making $55,000 a year, right now for healthcare, if they get it from their employer, they're probably spending, along the lines of $1,400 a year for healthcare. Under my plan, an employee making $55,000 a year will be spending $50 a year because it's 1% marginal, which means anything you're making over $50,000 a year, you're spending 1% of your pay on. So that is $50. If you're making $150,000 a year, then you're paying, again, just 1% of that marginal rate, which is $1,000 a year for healthcare, which is less. Right now, again, the average employee is spending about $6,000 a year for healthcare. So even someone making $150,000 a year is paying less under this plan, out of their pay, a lot less under this plan, under their payroll. Income tax. The income tax is 0.5% starting at $150,000 a year and up, and it goes up accordingly. And so, and let me, I'm gonna actually my laptop here and get some of the exact numbers for you all because I don't want to misquote anything. But hold on here. But and so that's part of it is going to be income tax. But again, no, if you're making under 150,000 a year, no income tax. If you make under 50,000 a year, it's 100% free. And let's keep in mind, if you're unemployed, you have free health insurance. That's a pretty important aspect of it as well. And so, so that's the payroll tax and the income tax. And okay, here we go. Let me get, okay. So, Yeah, so payroll tax, 1.25% for employers with 50 or more employees. So if you're a small business, right now, if you're a small business paying for healthcare, you're paying $20,000 a year on average for your employees' healthcare. If you're a small business with less than 50 employees, you're going to pay zero, nothing. Only over 50 employees, then you're 1.25%. And again, 50,000 over 49,900, so basically 50,000 and up, 1% payroll. Personal income tax over $149,509, you pay additional income tax. And so the here, I'm trying to see 1 second here. I want it because it's a graduated income tax, and so I want to get the exact number as it graduates, as it goes up in the marginal rate.
Yeah, no problem.
And I know it sounds like it sounds a little kind of wonky, but it's important for folks to know this. Okay. And then here, okay. Here, hold on a second here. And then then I want to get back to the personal income tax in a moment, but I also want to mention the gross receipts tax, because that's the other aspect of it. So the gross receipts tax of 2.3%. And a lot of folks that have looked at single payer plans have suggested sales taxes, but sales taxes are incredibly regressive. They're hardest on the poor. And so if you're talking about a 2%, and we already pay really high sales tax in our state and in our country, but especially in our state for sure. And so we really want to kind of avoid that as much as possible. And so that's where gross receipts tax. Some businesses are like, well, gross receipts tax a lot. Well, it's nothing on the first 2 million. And then after the first 2 million, again, a marginal rate of 2.3%. So if you're a company that has 4% or $4 million gross receipts tax, then you're talking about $46,000 in taxes that will go towards healthcare. Now that's in place of having to pay for healthcare for your employees. And that's the part people really have to be mindful of. And so, it's, folks need to be aware of that benefit that they're getting that they may otherwise not be aware of. They're just thinking about the taxes,
Mm-hmm.
And so that's kind of a basic rundown. And the other thing about the gross receipts tax is with the gross receipts tax, think about companies like Walmart and McDonald's, right? They don't pay for healthcare at all. And how do they avoid that? Why do you think people work 2-3 jobs? It's because their employers aren't hiring them full time. They're hiring them 20 hours a week, whatever it takes to keep them from giving healthcare. You've heard about it, how we subsidize Walmart workers, right? Through Medi-Cal, like billions of dollars we're paying for their healthcare. And so with the gross receipts tax, it now forces companies like Walmart to pay into the healthcare system. It forces McDonald's to pay into the healthcare system. The Targets are paying into the healthcare system. And so, and so in that sense, it's much more equitable because a lot of responsible employers, including a lot of mom and pops, want their employees to have healthcare, and they're hiring them full time and they're paying for healthcare. A lot of the neighborhood restaurants, they pay for healthcare, but Walmart doesn't. A company that's one of the wealthiest companies in our country, with the family with a bunch of billionaires, and they don't have to pay for healthcare. So
Another
that's
thing,
where I'm.
sorry, I didn't mean to.
Yeah.
Another thing I hate is when they say I'm not gonna name the retailer, but I worked at a retailer full time when I was in college, and they were like, "Yeah, work for us for 6 months, and then we'll start your insurance." So like you work for them for 6 months full time, and then after that 6 months, you qualify to buy into insurance.
It's crazy. Yeah, it's insane. Oh yeah, let me. I want to give you an update on the personal income tax. So Essentially, if you make between $150,000 and $300,000 a year, your income tax goes up 0.5%. Again, it's marginal. And what that means is you don't get taxed on your first 150,000. You're only being taxed on that second 150,000 at 1%. So what that means is you're basically paying $1,500 in taxes more. So you could be making $280,000 a year. You're paying $1,500 more in taxes, but you're not paying. They're also not paying premiums and deductibles and all that. So it's a huge cost savings for them, but they're paying into the system because they can. Now, between 300,000 and 600,000, it's 1% of taxable income. Between 600,000 and 1.3 million, it's 1.5%. Between 1.3 million and 2.5 million, it's 1.75%. And then 2.48. So let's just say 2.5 million and up, it's 2.5% of taxable income. And so, the wealthy have done well. And, again, they also won't have to pay for healthcare. If they own companies, they're not going to have to pay for healthcare. So they'll get that benefit as well. They just have to pay the payroll tax. So they're going to make a huge cost savings there. Workers' comp is presumably going to go down as well because now the government's taking care of healthcare, and healthcare cost is the biggest cost for workers' compensation as well. And so I think it's a very fair plan that's been put out there. And it funds, combined with right now, state and federal funds are the majority of healthcare costs. As I mentioned earlier, we pay more in public money for healthcare than any country in the world, which is really sad because we don't even guarantee healthcare for everyone. That's how much we're subsidizing the current for-profit system. When we're helping to subsidize insurance for folks, we're basically handing money to the insurance industry from our taxpayer money. And so this will move that money into CalCare and get rid of premiums, copays, deductibles, and instead have a progressive taxation system that also goes into CalCare. And you get rid of the administrative costs, which is about 20% of our cost, 20% administrative costs. That's tens of billions of dollars. We reduce that 20% to low single digits, like Medicare and the VA. Because if you don't have 100 different insurance programs, you don't need that administrative cost to figure it all out. You just have one payer. That's it. Single payer, right? And so you reduce that cost. You reduce the for-profit insurance industry costs. That really makes no sense. We're paying for this, quote, middleman that has the authority to tell our doctor no when they suggest treatment for us. And you get rid of a lot of the fraud. Because what happens if you have 100 different payment systems? Well, you now have 100 different ways of defrauding the system.
Yeah,
right?
don't get started on Medicare and Medi-Cal fraud.
Well, not even that. I'm talking even private insurance fraud. I'm talking about upcharging that occurs right now. Because we have cost containment in this bill. In the same hospital, you can have someone getting a procedure under Medicare that costs $800 or $1,000 or $1,200, and a private insurance company will charge $8,000 for that same procedure just because they can. It's nonsensical, and we're all paying for it.
So I was looking into Joe Manchin's. I get into rabbit holes sometimes, and I was
no.
Yeah, I know. And so his daughter used to work for a company named Viatris, and Viatris used to make, well, I'm not sure if they still make it now, but Viatris made EpiPens. And so she, with the help of the other parent company, which I believe was Pfizer, I could be misspeaking right now, but it was aligned with Pfizer. She worked with Viatris to double and triple the price of EpiPens. So it was selling for $150 for a 2-pack, started selling it for $600. And most of that profit went into her father's campaign, which was Joe Manchin, which was about $200,000. Well, obviously that's not most of it, but that was some of it. And, you know, we see this trend a lot, right? Where they hike up. I mean, Ash, I can't, you know, my mom has cancer. Yep. They were pushing this cancer medication on my mother, which was not for her, not for the type of cancer that she has. Each pill was $20,000. Each single pill. And I was like,
yep. It's crazy.
not
Yeah,
do
no, it's
or like a
absolutely
or something like that.
unconscionable and immoral, right? And there's a question actually about pre-authorization. So you will not need, like right now, doctors spend half their time on the phone with insurance companies because they have to get pre-authorization to treat you the way they suggest. It's just, yeah, it doesn't make any sense. But you won't need pre-authorization. Your medical professional will be the one making the call. And we're going to have auditing procedures and budgeting, kind of global budgeting mechanisms to uh, to combat fraud. Because inevitably, any system is going to have those issues. And we want to make sure that, yeah, we're going to hand the decisions over to the doctors, which we should do. But there are going to be some unscrupulous doctors who are going to take advantage of that. And so we do have, we're going to have to set up processes in place by the CalCare board to ensure that we also have an auditing process too.
Yeah. Yeah. So, and will undocumented residents be able to use CalCare as
Yep,
well?
absolutely, 100%,
Okay.
100%. Everybody that's a resident of California, and so, and that would include if you go on vacation or you're going out of town for business, up to 90 days, you still have protection coverage under CalCare. Pensioners, people that maybe worked for the state or city and they have kind of CalPERS pension, they can move out of the state or out of the country, and there's going to be a process put in place to make sure that they continue to have their insurance as well.
Oh,
And
wow.
yeah, and then there's an option for students too, so students can stay on it, but there's going to be a process for that too.
Wow. So, okay, I have another question for you. I'm annoyed at myself that I even have to ask this question, but so so I've met a couple of dentists and doctors here and there who have private practices, right? And they told me, like, kind of off the books or whatever, that they hate or really dislike accepting patients that have Medi-Cal.
Yeah.
And I asked them, like, okay, well, why do you hate accepting patients that have Medi-Cal? And their reasoning was that, well, Medi-Cal takes way too long to give back the money. Usually they try to dispute the cost. Like, basically, it's just
Yep.
a much bigger pain to get Medi-Cal to pay for something rather than like
Well,
or Blue
it's
Cross.
not just that. Medi-Cal, the reimbursement rate is also below Medicare and private reimbursement rates. And
Yeah.
so not only are they dealing with the bureaucracy of kind of waiting, they're getting paid less. And that's why, look, and I've said this to the media, I've said it time and again, I'm very grateful to the governor for expanding access to healthcare for everybody, including all undocumented residents. So now undocumented residents also have access to Medi-Cal, which is great. But ultimately, Medi-Cal is a second tier system of healthcare because you don't have enough doctors taking it because, they get paid too little from it. They have the issues with billing. And so if you're in the Central Valley, for example, you may have to go 2 or 3 hours to see an orthodontist if you are on Medi-Cal because there aren't dentists in that region that take Medi-Cal for those kinds of procedures. So there's a difference between have universal health care and universal access to health care. I say kind of jokingly, like a Lamborghini salesman can give me his card. Well, great, I have his card. I now have access to a Lamborghini. It doesn't mean I can actually, my bank account may say otherwise as to whether I can actually afford it. Obviously, a little dramatic example there, but it's true. You can have a health insurance card. It doesn't necessarily mean that you have access to health care if you can't afford it or if it's not available to you in a convenient manner.
I mean, expanding Medi-Cal is more so like kind of putting duct tape on a broken bridge, right?
Yeah, I agree. I mean, and I say that as someone that's always supported increasing reimbursement rates for Medi-Cal. I've always supported expanding Medi-Cal so that every resident, undocumented or otherwise, has access to it. But at the end of the day, it is still a publicly subsidized system in a healthcare system that's dictated by for-profit entities. And so we're still playing in their arena. And that's why Medi-Cal will never keep up with private pay. It'll never keep up with the privatization. It'll never, be enough. It'll always be second fiddle in a healthcare system. And I don't think it's okay to have, kind of a caste system within our healthcare system.
But, with single payer, like, doctors wouldn't have that issue, right? Like, it would be the same.
They'll get paid right away. They'll get paid right away. There's only one payer. They don't have to be on the phone all the time with insurance companies or Medi-Cal trying to wait to get reimbursed. We're not going to reimburse them at Medi-Cal rates. We're going to reimburse them at what they're worth. And keep in mind, over the last few decades, we have seen doctors coming out of med school want to be specialists. And why is that? Because they make a whole bunch of money. You don't make as much money as a pediatrician, as a family doctor. We want to reimburse. We want to pay family doctors more. We want to pay pediatricians and OBGYNs more. Those that can actually help with preventative medicine. And, we want them to be well compensated throughout our state, in rural communities, underserved communities. Right now, the way I put it is we don't have a healthcare system as much as we have a disease management system.
Yeah, 100%.
And like a catastrophic care response system. We allow fast food to kind of spread out in our community. So people eat horrible food. They get diabetes. They get heart disease. They get these other, ailments, obesity, depression that comes with it. All those things they get, and they go to the doctor. Doctors are overwhelmed dealing with insurance companies, this, that, and the other. So what happens is they just pump you full of pills until you have a catastrophic event. And that's where they make their money, off those catastrophic events. So the pharmaceutical companies make money off you being on a pill for the rest of your life or on several pills. And then the specialist makes money because we never really healed you. We never actually dealt with your underlying condition. You're patched up and you're given something to cover the symptoms to keep you as healthy as possible with those same ailments until you have a catastrophic event. And now the specialist makes all their money. The neurologists, the cardiologists, they make their money off of that. And instead of putting the money on the front end on preventative care, we allow people to just deteriorate and get comfortable living a life of having these major medical procedures, every several years with a bunch of pharmaceuticals they take the whole time. I mean, you watch TV, it's all pharmaceutical ads, which is also crazy. That wasn't the case when I was growing up. All you youngins out there may not realize that. It used to be against the law for them to advertise on TV. Did you know that?
They're such a joke too, because it'll put like a family that's happy, and then it's like all these warnings. I'm like, oh my god, you guys are crazy.
Yeah. But it wasn't. But 20 years ago, it was illegal to have those ads on TV.
Yeah.
And now that's all you see. Half the ads are. Why would they be telling us to go to the doctor and ask about it? No, we go to the doctor when we have an ailment. Then the doctor tells us how to treat it. Instead, We're going to the doctor saying, "Oh yeah, I saw this ad. I want that drug." And what's the doctor going to do when he only has 5 minutes with you now? When she only has 5 minutes with you now, as opposed to 20, 30 years ago when they actually can sit down with you. Like, okay, fine, yeah, that can help. Here's the drug.
Well, I mean, we saw a huge hike in antidepressants as well, antidepressant and anti-anxiety, and I think that's a bit too, because when Prozac and all of those medications came out, there was a lot of advertisement and pushing it out, and now millions of people are, which is nothing wrong with that, but I believe from the last book I read, we're the country with the biggest consumption of anti-anxiety and antidepressant.
Yeah, for sure.
But I had a question in the comments. Does this include dental and vision as well?
Yep. So this includes dental, vision, hearing, and critically, I used to be the chair of the Aging and Long-Term Care Committee. This includes long-term care, which is a disaster. A lot of you might be on the younger side and may not recognize the fact that we are in crisis mode when it comes to long-term care. Families are falling into massive debt. Some of you may be aware, if especially if you have a parent or grandparent that needs 24/7 care, and it's not just elderly. We're talking about this will cover long-term care even for folks who are younger that have some ailment that requires care. And so right now it's a crisis because we don't cover long-term care. Medicare doesn't cover long-term care. You know, and so we are in a crisis mode when it comes to that. This would include long-term care as well. And even like in-home care, especially, you want people to say, oh, Dad, how many nurses visits were you allowed to have under Medicare? They came to see you how many times?
Well, they're different, but they'll only give for 2 months period.
Yeah.
Whole year.
So in an entire year, they only cover 2 months of nurses coming for in-home care. So my dad had had nurses coming for 2 months, once a week.
About once
Yeah.
a week, but they have to take permission every time.
Yeah, every time they have to get authorization to do it. But then once the 2 months are up, that's it.
Yeah.
So now he has to wait a whole year before someone coming into the house. And he's not only on Medicare, he has Medicare Advantage. Through United Healthcare, he pays for the premium Medicare. That'll all be gone. And so during the health committee meeting, one of the Republicans is like, you're trying to take everyone's Medicare away. We're trying to give you something better.
Yeah.
We're giving you something better than Medicare. But that's what they're going to say, because people like Medicare. They should. Medicare is good, but we're going to give something better.
Wow. Yeah. I think one of the biggest issues too is that people just immediately equate this to Medi-Cal. They're like, oh, then we're all going to have Medi-Cal. And it's like, no, that's not it. Like, you explain it so perfect, because I've been trying to talk to people about this and they're like, I don't want Medi-Cal. Medi-Cal sucks. And I'm like, it's not Medi-Cal.
No.
Hard to explain. It's not Medi-Cal, dude. Like everything's being eradicated completely. And you know, I'm so happy that first of all, there's like multiple comments that said that it's really obvious that you put your heart into this, and I completely 100% agree with the viewers. But alongside that as well, you know, I know multiple people that are in medical device sales, and it's ridiculous.
Yeah.
I mean, they go to sales calls and they'll like rent a Rolls Royce. They'll rent a Range Rover, and then when I asked the person like, why did you rent a Range Rover to sell this like surgical device? And he was like, oh, because like the more like, you know, financially wealthy you look in a rental car, the more you know, medical devices you'll sell. I'm like, who's covering the Range Rover company? Like, what kind of money is behind this? You know what I mean?
Yeah.
Your sales rep is driving a Range Rover to sell a medical device.
Yeah, I mean, and that's where we'll have cost containment. We actually can set costs for medical devices, for certain procedures, because we're getting fleeced, and we have very little we can do about it. I can't do anything about it. I have, you know, if I go to a doctor or whatever, I can't negotiate. And it's one of the few services of that level of cost where you actually don't know how much you're being charged for the service. Think about it. You go to the mechanic, it can cost you an arm and a leg, but at least you know it doesn't cost me an arm and a leg. Like, you don't know. When you go to the doctor, what are you going to say? No, the doctor says, oh, we need to do this to save your life. We need to do this to get you better. We need to do this because you're sick and we can deal with this infection. Whatever. You can say no, I suppose, but who's going to do that? We go to the doctor, we go to the hospital, we go to the nurses, the clinic to be healed. And they're just taking advantage, but we're commodities. Our bodies are commodities, we're profit centers. And we have to change it. We've got to change that. And,
you know, is there like a job opening trajectory for this bill as well? Like, is it going to create new jobs?
That's good. I'm glad you framed it that way, because usually how it's framed is, what about all the insurance jobs and all the jobs are going to be lost? So on that point,
so I'm with you on this. Like, this isn't. I'm not trying to put you in a corner.
It's like don't look up. It's like, oh yeah, I'm for the jobs the comet's going to bring, right? It's like, but 1% for the first 5 years, 1% of the budget is going to go towards job retraining and getting folks that are going to lose their jobs into new employment, whether it's they can work for CalCare. CalCare is going to need a lot of folks, not as much as the insurance industry currently employs. But the bottom line is, we'll have resources to retrain, to help folks go back to school, whatever it is, so that they can, so that we can deal with the job aspect as well. But there are jobs to be made, obviously, in the CalCare infrastructure too.
Yeah. Yeah. Well, oh my God. I'm really scared about, I think the only thing that I'm really scared about this bill is the lobbying that's about to go behind it. That
Oh,
really
yeah.
out, because
It's already happening.
yeah, really.
Oh yeah. Oh, they already have like social media ads up. They're already, threatening lawmakers about sending a bunch of mailers in their district against them. I'm sure I'll be seeing something against me soon. Yeah, they have millions. I mean, they're going to spend a lot of money attacking us.
How long have you been wanting to write and pass a bill like this?
Well, my whole career.
Your whole career? Yeah.
I mean, I've been for single payer like as long as I've been in elected office. And when I got elected, there was a single payer bill. My first year, at that time, Senator Ricardo Lara had SB 562. I quickly co-authored it, but then it just died. And so then also Trump was president. And at that time, during Trump's presidency, I think appropriately so, the number one focus was to not let him dismantle the ACA. As much as the ACA has its faults, the reality is that there are a lot of people that have coverage because of it. And so the focus was, okay, we got to beat back Trump, make sure they don't dismantle it. We were successful in that. But then as soon as Biden got elected, I'm like, in the middle of COVID, it's go time. Like, if we don't do it now, when else will we possibly have the momentum, the movement, the force of justice behind us?
I do think that this is just my I don't know. I'm not an economist or anything, so this is just totally my opinion, okay? But I'm a subreddit named Anti-Work started, has over 1 million followers, right? We're seeing the labor shortage. We're seeing the rise of unions. The first Starbucks just unionized.
Yep.
You're seeing an uprise of people that are truly starting to get sick of the late stage capitalism that we live in right now. And I think that this bill is literally coming at the most perfect time that it could come. Because even if it was pre-COVID, I would still be like, oh, I don't know if, but we're seriously getting to a point where people are starting to get really sick and tired of the system and the late stage capitalism that we live in. And I do think that you will receive all the support that you can get. But I mean, listen, my followers are we're totally behind you. You know what I mean? We want this to get passed, but it's I think a lot of people just they don't know how to help. They don't know what to do, because I know people from outside the state that also really want this to pass in California, because if it passes in when it passes in California, right? It would mean other states will follow suit, right? It's gonna leave a benchmark.
And there's a bigger, and first of all, people in California, find out look up who your assembly member and senator are. Call them, email them. It matters. We in my office, we keep a tally of constituents that contact us on any bill, for and against. Trust me, they know. They're going to be told how many people are calling in support. So call, email, be gracious. We have to get their people, bring them to their senses, not to their knees. But this is a loving movement. It's a movement of justice. We have to be firm as well. And, but it's important also to note that when it comes to homelessness, when it comes to healthcare, the fear of losing your healthcare, the fear of becoming homeless in a country, in the wealthiest state, in the wealthiest nation on earth, there shouldn't be either of those fears, right? But they're there. Why can't we just solve it? We could. At the end of the day, remember that, today, as we remember Dr. King, who was very much an anti-capitalist, understood how capitalism was used to oppress and continue oppression. That is that fear that keeps people in line. You know, I will speak up at my job. I'll show up to this protest, but I'm worried because I have kids to feed. I have a roof over my head. And if I lose my job, I become homeless. I can lose my health care. It's that fear that's necessary to keep us like little robots, just working, right? And we have to overcome that fear, and we have to support one another through that, which means that it takes sacrifice.
Yeah.
It takes suffering. And we have to be there for one another, because the reality is that it's easy for me to say, I can't tell someone else to make that decision for their family, right? That's why I have my strike shirt on. I'm so just in awe of workers who go on strike. I remember it was the last year? No, it was the first year of the pandemic. It was May 2020. And I showed up at 5 a.m. After a week-long strike of McDonald's workers, just here in North San Jose. Mm-hmm. And I showed up as they returned back to work. And they went on strike because the McDonald's management owner wasn't putting up health equipment, like, you know, glass dividers and sanitation equipment and gloves. And so they went on strike. They came back. They went on strike on Monday. I think a Friday they went back to work after striking those 4 days. And I was there at 4:45 a.m. They all started showing up. We had a little, you know, rally. Not a rally, but it was a happy moment because the restaurant did all those things they asked for. They should have done it anyway, right? But the fact that they had this strike just to have basic protection. Remember, we call these essential workers heroes. That we can call them essential, but really our country is treating them like they're expendable. The number one job that's died from COVID is cooks. Now, where do you think those cooks? You think they're at the Four Seasons Hotel or some fancy restaurant? No, they're at McDonald's and Jack in the Box. They're the ones that are working while most of us are able to stay at home. Cooks, farm workers, grocery store workers, delivery drivers, even those working for those horrible companies, you know, that are delivering stuff and allowing us to stay at home. And we have to recognize that this is much bigger than just the issue of healthcare, but healthcare it's all tied together. In the middle of a pandemic, it's as clear as day how it's all tied together through health. If you're not healthy, you have nothing. And yet we're, you know, in my district, my assembly district has the 3 zip codes with the highest number of COVID deaths in the entire Bay Area. Right here in East San Jose. Mostly Latino. These are the workers that can't stay home to work. These are the workers that aren't being given paid sick leave, even if they get COVID. And by the way, they're preparing your food, being forced to come into work, even if they've tested positive for COVID. And so, you know, this is a moment that the working class has to rise up. And we have to support them. We have to support them rising up, especially if we have the privilege of being able to work from home, especially if we have the privilege of having healthcare. We don't have to worry about food on the table, right? And so we have a lot to be thankful for, but the only way we pay it back is by standing up for those that are suffering.
You know, there's another content creator on TikTok. He's a historian. He has really great content actually, but he was on live the other day and he was saying that America had one of the biggest labor movements ever. Yep. Multiple labor movements that actually gave us the rights that we have now. Like, right. You know, 15-minute break every 2 hours, et cetera, et cetera, et cetera.
The weekend. the weekend.
Right. Yeah. Weekends and stuff like that. But a lot of people don't know about the labor movement because it's very buried within history. A lot of the other countries like French and British, they use our model of labor movement that we used back. I believe it was the Industrial Revolution, if I'm not mistaken. But we have a history of standing up and revolting, very, very like group. Sorry, my battery notification came on. Very gruesome, right? Like sometimes it would end up in really big public protests and stuff like that. But that's the only reason why we have the rights that we have today.
Well, yeah. And so this is basically and so I liken it. So that was during the it's called the Gilded Age, when we had robber barons, the folks that ran the railroad companies, the oil barons, so Standard Oil, the Rockefellers, J.P. Morgan. Those are the robber barons. And people had to rise up that's how we got rid of child labor. That's how we had the weekend. But people died. A lot of people died fighting. And even then, the government used the force of government, police officers. Police would come and beat people and shoot people that were protesting and rioting. And what we had to and also at that time, there was the international solidarity of the workers movement is on May Day, May 1st. Well, the U.S. government moved Labor Day to September.
He was talking about that.
Yeah, to separate it from the rest of the world.
Yeah.
May Day, May 1st is Labor Day. It's Workers' Day. And so we have to never forget that it's an international day of the worker. And we've had marches here on May Day. In fact, about maybe it was 15 years ago, 14 years ago, one of the largest marches in the history of San Jose, it may have been the largest ever, was a May Day march. It was beautiful. Everybody was wearing white. It was a march from East San Jose to downtown. It was absolutely beautiful. And we have to reconnect with the rest of the world, because this is not just happening here. Workers are being taken advantage of all over the world. But when it comes to healthcare, our workers get taken advantage of. They're focused on transforming politics. And so I think that there'd be someone to be great for you to connect with. In fact, I'll connect you with Jane Kim. And I think she'd be a great person for you and your followers to kind of just learn more about.
Yeah, of course. Actually, I haven't told my followers about this. I'm working with a nonprofit hired by the city of Oakland to promote the COVID vaccine. So we'll be doing a little bit of that soon. I'm starting to get connected with different people. But I would love to get connected with her and go to that event. I would absolutely love that. I think that would be really cool. And I think my followers would do that as well. But when I meant like the statewide protests, I meant for like AB 1400. I didn't mean like a full labor.
So
I'm sorry, I said that and I was like, I probably sounded so dumb after I said that, because I didn't like actually,
There's a lot of there have been a lot of actions for AB 1400. We had a car rally, which was really awesome because it was 2 days after. It was a lot of fun. We've been doing a lot of social media, and there are events. I know today in LA, during MLK Day, there was also a parade of cars supporting it. So there are events going on, but right now it's about the members of the legislature trying to get them on board. So the best thing to do is contact your legislator. If it does get through the assembly, I'm going to plan with students for a single payer health plan, a single payer health care, to do rallies at college campuses around the state.
That would be amazing.
Mm-hmm. Yeah. So I think that would be great to get young people to the thing is that over 80% of Democrats support single payer health care, but the majority of Democrats in California don't know about AB 1400. They don't know there's actually a bill right now. And so it's our job to inform them. Well, there's actually a bill right now that can bring single payer health care, the most significant first step, which is getting a policy passed.
Yeah, absolutely. I totally agree with you. And really keeping that messaging absolutely clear as well, right? Because I remember with the contracting bill that Uber and Lyft and DoorDash and them spent so much money on, they made that bill sound so confusing because
Of course.
I would watch Hulu and there would be one ad that came on that would be like, this is so bad, this is so terrible. And then like simultaneously right after that it would be another ad. Oh, this is so great. This gives workers
And they convince people that they're like, we're gonna give health care to our workers. We're bringing minimum wage benefits to our workers. It was all a lie. I mean, they lie. It was all full. It was 100% a lie. It's now been exposed as a lie, but it's too late because it passed, right? So, yeah. So here we go.
Even I myself, who I feel like I kind of understand politics as much as I can, that was the one bill where I was like, I am so confused. Like I don't like there's so much ads going on everywhere. But yeah, Ash, anything we can do, because I know people outside of the state really want to help as well. I personally know I have multiple, I'm not even exaggerating, I've had multiple followers like reach out to me who are from New York, Texas, and they're like, we really want this to pass, but we don't know how to help. And so is there any way that they can also help?
Yeah,
like,
I mean, I think that
but like eventually.
I mean, there are like, if you go to the nurses, let me look here, let me get the proper. Okay. Okay, so if you just go to National Nurses United and go to campaigns, one of the campaigns you'll see there will say CalCare. Click on that and then sign up. There are virtual phone banks going on. There's petitions and support. Obviously, social media. You can connect with your friends in California. There's a lot going on, and so it's a great way to learn more about the bill too. I also on my page have a dedicated page to AB 1400, but the CalCare, the nurses page will have action items that you can follow up on.
Amazing. That's so great, Ash. Like I'm so excited for this. I'm really hoping. I'm praying it passes because like I can't. Okay, so you know a little bit about me. I was like a communications director for a nonprofit, and I really wanted to leave to like make this progressive brat thing like the biggest thing possibly make it. And one of the biggest reasons and why it took me so long to actually do it was because of insurance. Because I was like, I don't want to live without insurance. There was a while I didn't have insurance, I was like, you know what, I'm just gonna have to bite the bullet. Like, hopefully no one hits me with a car or something. But it's one of those, like, I can't even imagine the endless possibilities that will open up, because this isn't just because people have just about everyone having healthcare, right? This is about what can we do for our economy. I mean, San Francisco was one of the actually probably the biggest city that was hit with small business closures. Over almost 50% of all small businesses in go closed. And when small businesses close, monopolies like Amazon and stuff grow bigger and bigger and bigger and turn into like monopolies and stuff like that, which it is right now. But just having that like safeguard of, hey, you know what, I'm gonna have insurance even if I quit this job, even if I leave this relationship, even if I leave this marriage. I can't even imagine like what that would for the long-term economy of California as well.
Exactly. Well, it's also it's about choice, right? Like it's a freedom of choice, and the freedom with having more money in your pocket. I think the right wing Republicans like to talk about freedom all the time. This is the ultimate kind of freedom and choice that we're giving to Californians.
Yeah, no, absolutely. It really is. But well, I mean, so you're gonna have, I mean, like from my understanding of this, you're most likely gonna have biopharma against you as well as.
I mean, all pharmaceutical companies, the drug industry, I like saying the drug industry because they're basically pushing drugs, but they're drug pushers, right? I mean, think of the opioid crisis, which was pushed on people it's like, that's why I've always been about legalizing all drugs. Cannabis we've done, but at the end of the day, the war on drugs has been a war on poverty and war on poor people. Um, Chris Rock once said that the government doesn't care if you do drugs as long as you do their drugs, right? The
Right.
ones that profit their campaign contributors, that profit their industry, and then they use the other drugs that are not legal to lock up poor Black and brown people.
Yeah. Yeah. No, absolutely. I mean, there is a huge lawsuit against biopharma for the opioid epidemic as well. I think
Yeah,
they owe a
yeah,
bunch.
but they'll pay a few billion. They profited many billions. So for them, it's cost of doing business, right?
Right.
Like, they killed how many hundreds of thousands of people died, and they'll pay a few billion. They're still billionaires. They're still wealthy. They still made their money. So that's the problem with the way our system is set up. That under the economic system, where you're incentivized just to profit, which is capitalism, harm that's caused is just an equation. So as long as you still make money and you cause harm, then anything you have to pay out for that harm being caused is just a cost doing business.
Right. Yeah.
And that's what the healthcare industry does constantly.
Yeah.
Everything's a number. If it's going to cost too much to care for someone, they'll deny your coverage. If you can make a bunch of money off of it, you'll suggest it and recommend it, and you'll do all these tests and this, that, and the other, and you'll make money.
Well, I actually, you keep bringing a common theme up that drugs are, it has a lot to do with drugs and like pushing drugs and stuff like that. So would single payer healthcare, would that program also promote more healthy eating and ways to do that? Because I feel like a lot of people also don't know how to cook healthy food,
Well, there's a couple of different things. One is that it'll allow us to bargain on behalf of 40 million people to reduce pharmaceutical costs. So if the costs go down dramatically, there's less incentive for them to push it because they're making less money in California as opposed to other places. Number two, it does put control back into the doctor's hands as to how to develop treatment. And so if they have more time, so that because they're not on the phone with the insurance companies all the time, they can actually now spend more time to focus on preventative care and nutrition and things of that nature. The third thing is that we will have the opportunity to pay general practitioners more and pediatricians more, especially if you're a Medi-Cal patient. And so we have the opportunity to incentivize doctors that have the ability to focus more on preventative care and not reactionary care, the specialists that make all that money.
Wow. Yeah. And also, I'm now I keep thinking about more stuff too as well. Would this in any way kind of change the cost of healthy food as well, or making like healthy food accessible? Because like I think a lot of the argument is like, hey, well, fast food's a lot cheaper, right?
Yeah.
I don't think it's AB 1400, but I'm just like I'm kind of just like thinking, you keep talking about this theme of like, of drugs and pushing drugs that and really just kind of putting a band-aid on.
I mean, we have a complete disaster. Our food industry, our healthcare industry, it's all connected. They push really unhealthy food on us, and then they push this really expensive healthcare industry on us to deal with the issues that were caused by the food that they pushed on us. And so, we've got to have better healthcare standards, better food standards, food quality. We barely inspect our food. We have horrible meat production and meat processing, which causes all these pandemics. And push more plant-based, which I obviously try to do as much as I can.
Yeah.
And bring down costs, certainly, but I think that's where we have to focus a lot on community gardens and other things that can bring, California, San Jose was the best. It was the best. This used to be, for all you young folks out there, you may not know, this used to be called, before Silicon Valley, the Valley of Heart's Delight. It was the best agricultural land in the world. And so people, the dirt is still there. People can do community gardens and we have to teach people how to eat properly so that they understand that, and not just push soda and fast food from all the commercials. And in poor neighborhoods, you see a bunch of fast food restaurants and liquor stores and all that stuff, right? And so
Yeah, like
zoning has a lot to do with it too. And city council members, I mean, you have to be aware of what everyone's doing at every level of government that represents you.
do you think do you think the people against you might prop up like a candidate to run against you and outseat you? Do you think that's a possibility?
Probably,
No.
but whatever. It's like I have no fear because I'm not doing this for me. So it's not like that's the problem with people, elected officials, especially the higher up they go. They're afraid of losing the position, not because of the service they can do, because of the perks and what they get out of it personally. The power, it's intoxicating, and none of that. I don't care about any of that. So they can't threaten me. If their threat is we're going to boot you out of office, it's like I have plenty of ways I can serve, whether I have a title next to my name or not.
You've basically put your whole life on the line for this, and you're like invincible because no one you ran off of complete grassroots as well. So there's no lobby or campaign funding towards the campaign that brought you into office that could threaten you either. You're seriously, like, you were voted for the people, and now you're honestly serving the people. And if they outseat you, you're like,
But that's what I tell to folks, because there's only two of us in the legislature that don't take any money from corporate PACs, me and Alex Lee.
Right?
And Alex Lee.
Yeah, you and Alex. Okay, got it.
And when I talk to colleagues about it, they're like, well, you don't want to unilaterally disarm yourself. You don't want to put yourself at a disadvantage. Currently the system allows for it, so I don't want to have a challenge that's going to be a challenge that can raise a whole bunch more money. But the reality is, if you're doing the right thing, the people are going to be with you. And I represent a community that's a district that's mostly Latino and Asian American, but the largest Vietnamese community of any city outside Vietnam. So I'm not, and so the Indian community of the API is very small, like 2% of the registered voters, 2 or 3%. And so I'm at a huge demographic disadvantage in my district, but I'm representing my people. And so, that in itself protects me, because I don't need to raise millions of dollars because I'm voting against their interests. So I need all this money to flood the district to convince them to reelect me. And so it's kind of, I don't know. That's how I see it. Others don't always see it that way. But I think you don't need as much money. I mean, I had over $6 million spent against me when I ran the first time, and we beat that. And
How much did you beat your campaign?
So I raised about 1.3 million. My opponent raised about 1.5 million, and there was over $6 million outside money attacking me. And there was about $3 million for me that was mostly from criminal justice, reform folks, environmental justice groups, labor groups. So all the kind of the progressive contingent came together and had my back down the stretch. And that was huge.
Do you think is there a lot of assembly members that are funded by biopharma in California? I haven't looked that up, actually. I should probably look that up.
Oh, the healthcare industry is one of the biggest. The healthcare industry is one of the biggest contributors to campaigns, for sure. So I presume everybody gets some, other than me and Alex.
And Alex is about to, we talked about it before we came on stream. Alex is also about to have a
serious challenges. Yeah. And let me also say that some of the people that do take the money some are co-authors of 1400 and are firmly in our corner. So it's not
right.
like, so it's not that because they get a check that they're going to do the wrong thing. But
right.
in total, having that money in our system is a bad thing,
Right, and also you never know, right? Like I think that kind of money always puts you and other supporters of AB 1400 at risk too. Even like it's a little bit of a risk, right? I guess. But I
Yeah.
think, you know, Ash, I think you're a great example of what voting in true progressives and people that are funded only by the people really do for their constituents, right? Because I know Alex passed some pretty, like, he's been putting in work for the people
Yep.
as well.
Yeah, he's been great.
Since the first day that he was elected, like, right?
Yep.
The first day that he was elected, submitted a bunch of stuff and, you
Yep.
know, stuff like that. I don't want to misspeak because I don't know exactly, like, I've read about them, but I don't know them on the top of my head. But, you know, I think this is a great example of what true progressive candidates like look like. And I think you're a great example of that. Also, the comments are going off about you becoming president. So
I was born in Canada.
Oh, you have to be born in America to run, huh? Yeah, I forgot about that.
Yeah,
Do you have support on this bill, by the way? I forgot to ask.
What was that?
Do you know if you have Newsom support on the bill as well?
Not yet. It's kind of complicated.
Yeah.
He did not speak. Like he kind of brushed it aside when the reporters asked him about it. But that's okay. You know, we still have time until it gets to the Senate. I think that our focus right now is getting it through the Assembly. If it gets to the Assembly, then, you know, hopefully his administration will engage then.
Okay. Yeah.
But I have to get out of here. It's been a great conversation.
Ash, yeah, of course. I'm sorry. I could speak to you for hours, but I was just.
No, we'll do it again. We'll do it again for sure.
No, for sure, Ash. Anything you need, please let me know. My followers are 110% behind you in any way, shape, or form that they could support you. They will. You know, we might be small, but we're pretty mighty, I would like to say. Also,
I'm gonna flip my camera so you can say hi to my dad. Ready?
Oh my God! Yeah, of course. Hi.
It's a wonderful conversation. I really enjoy.
Yeah, he's saying he really enjoyed the conversation.
Yeah.
Oh, tell your dad.
Say bye, Dad. Say bye.
Bye-bye.
I always tell Ash I love seeing you on the camera.
Yeah.
You look like the sweetest person ever. Well, he is the sweetest person ever, but on camera he just looks so sweet.
Yeah.
Everyone's saying, oh my God, everyone loves your dad as well.
Yeah,
well,
I know.
Listen, anything you need from my supporters and I, like, we are here all the way. I'm so sorry about the Twitch. I'm still
It's all good.
I tried these new layouts tonight and it just was not liking me or working with me. But please send me the info about the event in LA, because I'm definitely gonna slot time to go to that.
Yeah, you could even go down as media. You can try to get a media pass. That's probably the best thing for you to do. Yeah. Okay.
Do you have the website or anything that I could, like, check out?
Yeah, just go to it's the California Democratic Party website. So it's cadem.org, cadem.org.
Okay. Sounds good.
Yeah.
I'm definitely gonna look that up. But Ash, thank you so much. Also, this recording will be on YouTube, so I'll make sure I link it there as well.
Okay. All right. Thank you.
Bye.
Bye.
Bye-bye.
Bye.